Well, it's time for our health report, and joining us now is Africa 54 health correspondent Lina Mudu with the latest details on the commitments African leaders are making for health on the continent. Hey, Lina.
African heads of state and government, ministers of health and finance, business leaders and global partners gathered Saturday prior to the AU summit to launch a new initiative aimed at increasing commitments for health on the continent. The new health financing plan aims at closing the funding gap, improving the impact of spending, and ensuring the achievement of universal health coverage across all African Union countries. Public and private sectors, as well as donor governments, pledged up to $200 million to help end epidemics and bring universal health coverage to all. The Higher Life Foundation, Ireland, and France all committed to increased financing for health in Africa. Japan has considered universal health coverage as an agenda item at the G20 Osaka summit later this year, carrying forward commitment to and collaboration on health. Nearly 77% of women in Nigeria use skin lightening products, making the world's most populous country of black people the biggest market for whitening skin. But darker-skinned Nigerians are beginning to push back against the tide with the so-called melanin movement. Timothy Obiezu reports from Abuja.
25-year-old Goodness Ben wants to be a famous model and actress. For her dream to become reality, Ben says she needs a lighter complexion, so she bleaches her skin.
Yes, this is Nigeria, and a fair skin is business. In movie industry, most times directors want you to glow.
According to a 2011 estimate by the World Health Organization, some 76 million Nigerians, the majority women, use products to lighten their skin. The treatment, a multi-billion-dollar industry, reduces the content of melanin, a substance that gives skin color. Nigerians such as Ben say it also improves their confidence.
Yes, for me to be better, for me to be fairer, for me to be more beautiful. And I feel a fairer skin attracts more favors.
But darker-skinned Nigerians are pushing back against the idea that lighter is better. They say black is beautiful with the so-called melanin movement.
My confidence really doesn't come from my skin. It comes from within.
Aside from debates about beauty, skin doctors warn some bleaching products are not safe.
Many of these harmful substances that are contained in these skin products can lead to a lot of negative side effects like, for instance, skin cancers.
Ghana, Ivory Coast and Rwanda banned all whitening products, while Nigeria joined South Africa in barring those with harmful chemicals. But while these moves help promote natural and healthy skin tone, the melanin movement is still dwarfed by Africans' demand for skin lightening products. Timothy Obiezu for VOA News, Abuja.
Now to Madagascar, where the country is suffering its worst measles outbreak in decades. More than 50,000 people have been infected and at least 300 killed, most of them children, according to health officials. Cases have been reported in all major towns and cities, as well as in rural areas. Supported by the World Health Organization and UNICEF, the government has initiated fresh vaccination campaigns. Although worse hit, Madagascar is not alone in having to tackle the virus. Measles has also struck parts of the United States and Europe, where cases tripled last year. Health authorities in the Philippines are also urging immunizations following an outbreak in Manila and nearby regions that has left 1,500 people infected and caused at least 25 deaths. The WHO says measles is an acute, highly contagious viral disease. Health experts say the virus gained ground in Madagascar as immunization rates fell below 50% from the recommended 90%. Joining us live via Skype from Antananarivo, Madagascar, is Dr. Vincent Sodjinou, Incident Manager with the World Health Organization, Madagascar. Dr. Sodjinou, welcome to the show.
Many thanks, dear colleague. How are you?
Doing great. Thank you so much for joining us. Listen, immunization rates have fallen below 50% in Madagascar. What seems to be the main cause?
Many thanks for your question. Routine immunization is a scheduled program who is implemented in health facilities and through outreach services in some village. And for Madagascar, we see that when we use the administrative coverage provided by the Ministry of Health, the coverage is around 90%. But when WHO and UNICEF implemented survey at community level, we saw that the immunization rate was low, under 60%. How can we explain this situation? First, we have a lot of people who are not going to the places where vaccination is implemented. In addition, we have in Madagascar many areas who are hard to reach area where it is difficult to implement routine immunization. To come over this situation, the government has organized many immunization campaigns to reach people who had missed the routine immunization. Despite this campaign, we were surprised to see that there are many remaining people who are not really vaccinated, and that's why now this outbreak is ongoing in the country.
So vaccination is to prevent. Now that the outbreak is spreading, what is being done in the communities to help tackle this?
Okay. For the response to this outbreak, we have around 5 main pillars of intervention. The first one is the case management, who is being implemented in all the local health facilities, all the hospitals in the country. In addition, we have the reactive vaccination, who is organized in 4 phases. The first phase is already completed in around 25 health districts, and we have reached 2.2 million people during this first phase. We are currently implementing the second phase of this vaccination in the northern part of the country, and we are targeting around 835,000 people. At the time of the fourth.
Dr. Sodjinou, we have to leave it there, unfortunately. Thank you so much for joining us. That's all the time we have. And Vincent Sodjinou is the incident manager with the World Health Organization in Madagascar. And that's our health report for today. To stay in touch, find me on Twitter @LenorMoudou. Vincent, back to you.